again. Okay. Thank you so much for every one of you that have given us the permission to record. Once again, like I said the other time, my name is Associate Professor Laido Bunshiji. I'm from Western Sydney University here in Sydney, Australia. And like I also said earlier on, we would really like to start by acknowledging the traditional owners of the land where we are all seated and located now. I'm personally on Darug Nation in New South Wales. And if you don't mind, you can pop in the name of the land or nation where you are seated at the moment. We sincerely thank all the elders, past, present, and emerging. Next slide, please. All right, in terms of those that are organizing this event has been kindly put together with the partnership between Female Genital Mutilation Awareness Australia, FGMAA, Western Sydney University in Sydney, and Multicultural Centre for Women's Health that houses NETFA, which is National Education Toolkit for Female Genital Mutilation Awareness, and working closely with Australian government because NETFA is a federal government funded project. So these great organizations are very proud to have put this event together. And thank you for joining us. Next slide, please. Okay, let's just do a little bit of some housekeeping for every one of us so that we are all on the same page. Access requirement is very important, and what we mean by that is that it's just anything that you need to make you to be present and to be able to participate here today. That could be in terms of a break every hour, wherever you are. You can just turn off your camera. If you need to stand up, have a toilet break every hour, it's up to you. And you can also, rest your eyes if for whatever reason you need that to take place. So we are very much aware of that. Next one, next slide. Okay. All right. Please, we will really encourage you to be present with your Zoom video on. Similar to what Rani said by the time we started, that will give us a sense of a community that we are here, except this is not possible due to access requirements, and we understand. So please turn your phone off the entire time without multitasking. Turn off your mic if you are not speaking. Kindly use reactions and the chat to ask to engage with the group. You can also raise up your hand to ask a question or even pop your question into the using the chat function. When the time comes, we will have dedicated time for Q&A for all these questions to actually be heard. Please share your pronouns in Zoom, and when you introduce yourself, just feel comfortable to do whatever you feel like doing. So please be considerate about the language you are using, because we are all aware that this is a very respectful and respectable space. Thank you. The next slide, please. So pretty much this event is about sensitive topics, which may be potentially disturbing. So the issue of content and trigger warnings is very, very, very important to us, the organizers of this event. So it is important to create an atmosphere of mutual respect and sensitivity by following some, important rules. They are not too onerous, but some, simple rules that can keep us all on the same page. Please give a warning if you're about to share graphic content, whether verbal, visual, or anything that could be, particularly triggering. The event co-host will saying that the co-hosts actually reserve the right to interrupt or stop speakers or guests in order to create safer spaces at the event. Your safety matters to us here. So everyone, we want to ensure that we are all safe here. Thank you. And if you have experienced FGMC, you do not actually have to share your personal experience. But if you decide to do so, please do not share graphic details. There will be some graphic descriptions of FGMC by our speakers, and every now and then, and its impact throughout this event. But if you feel triggered by the presentations, discussions, you may kindly choose to switch off your camera and leave the event for a significant time, and we do understand. Next slide, please. Quickly, what is it that today's event is not? It is not a therapeutic space. So please be mindful of this when and if you decide to share. It is actually a learning space. Thank you. Next slide. We have some important health support lines, and you may take a screenshot of this if you like. All these lines are available to support you in case you require additional support as a result of what you hear today, or as a result of some other health issues that you may be passing through. So if you like, and take the screenshot, or if you require further assistance, you can contact any one of us that are co-hosts on this particular event. Thank you. The next slide, please. Okay, this is a continuation of the mental health support that we have available. Thank you. Next one. All right. So just to keep every one of us on the same page, this is how the event today is likely going to go. And I'm the one that I've just been talking us through the welcome and housekeeping, content and trigger warnings, mental health support. And we'll be going straight to our speakers today. But please don't forget, in the course of the presentation, if you have any questions, please pop them in the chat box. And when the Q&A time comes, those questions will be made available to the speakers, and they will respond to those questions. So once again, please sit, relax, and take the best out of today. You are all very warmly welcome. Thanks. So we go to the first presenter now.
You want me to jump in?
Yeah, okay. We have the first presenter, who is Dr. Moraa Nyachoga. She was the statewide coordinator for CARD COVID Health Engagement Project, CCHEP, Refugee Health Network Queensland, Hospital Brisbane. Dr. Moraa, you are welcome.
Thank you so much. And once again, thank you for inviting me to be a speaker today. It's really such an honor, because I think this is such an important topic to unpack so that we're able to care for communities in the right way. And also, as mentioned before, just a warning about some of the images we'll share today as well. So thank you once again for joining us. Just a little bit of introduction so that you can have the context of where I'm coming with this. So I'm originally from Kenya, which is in East Africa, and I've cared for clients in the Kakuma refugee camp, and I've worked a lot with different communities, and I'm really passionate about this area as well. So I'm just kind of sharing some of the learnings as I did care for the clients from different communities. So yeah, next slide. So what is FGMC? As mentioned before, it's the female genital mutilation or cutting. It involves the partial or total removal of some parts of the female genitalia due to non-medical reasons. There's various types of FGMC, and as you can see from that particular slide, we do have 4 different types. The first one is called clitoridectomy, and that's a really big word, but really means the removing part or all of the clitoris, as shown in the image there. Type 2 is what we call the excision, and it does involve removing more than the type 1, so a bit of part of the clitoris, as well as I won't use so many scientific terms, but it really involves more of the removal of parts of the female genitalia. And we can see type 3 as well there. It involves more tissues being removed from the female genitalia, and type 4 is really one that is the most extreme, that removes, it involves removal of quite a lot of tissue from that particular area for the females. Next slide, please. So I just wanted to share this so that we can all have a little bit of understanding of some of the reasons or some of the factors that people perform FGMC from different places. So the first one really, it's a social norm. It's part of the community, it's part of the society there. So they do it really because it's part of their society and it's part of their culture. The second reason, and this really will inform how you have that conversation with that particular client. The second really factor is most people do FGMC to prepare the girl child for, adulthood or marriage, and to them, it really makes them well prepared for that next phase of their lives. The third factor is what most societies think, it increases marriageability. That means the girl has a higher chance of getting married. The fourth factor is ensures premarital virginity and marital fidelity. So these are some of the reasons that most communities practice this FGMC. The other main reason we do here is cultural ideals that, just that femininity and the notions that, girls are more clean or more beautiful after removal of some of the parts from the female genitalia. And in actually some communities, they do consider those parts that are removed unclean, male parts, or even unfeminine. So those are some of the reasons that some of the clients will let you know, and religious reasons as well. So I think it's just important to know the context when you're really engaging with the client. Next slide, please. So what are some of the complications of FGMC? And this is not all, these are just some of the most common ones. So we do have those immediate ones just immediately after the FGMC has been done. We do have severe pain, and I won't go through each one of them, but we do have excessive bleeding, particularly for those that are done probably at home in an unsafe environment. We do have tissue swelling, we have fever, we can have some of them presenting with really severe infections, particularly those that are also done in very unclean and unsterile environment. We do have wound healing problems. We can even have shock and death if maybe a client bleeds to death and they get an infection and they actually bleed to death from this particular FGMC. Some of those long-term complications include scar tissue and keloid, and that really means that because that particular area has not healed very well. So we have that scar tissue making it wants to heal, but really doesn't heal in a fashionable way because the approach in which it was conducted, it wasn't really sterile or wasn't really in accordance to medical procedures. We do have menstrual problems later on amongst the clients. I think a big problem that I personally experienced with some of the clients was sexual problems. And this comes when you're having a chat with the clients, there's pain during sexual intercourse, and there's also decreased libido for the clients. We do have infertility issues, which come up after this practice as well. I think also one of the main common ones that I did experience caring for the clients is childbirth complications. We do have things like difficult delivery, excessive bleeding, particularly because of the scar tissue that has already been formed. We do have most women needing to have cesarean section and also need to resuscitate the baby because, the passage of the baby is very restricted. So you have the baby coming out of the womb with asphyxia. That means difficulty to breathe because of the difficulty in delivering. We also have long-term psychological problems, mental health issues, as you can imagine, particularly for type 3 and 4, and even all the types really, the manner in which it's conducted, it can lead up to a lot of mental health issues, and some of the reasons are listed there. Next slide, please. Next slide, please. I think this slide, oh, perfect, thank you. So in terms of just the basics of management, really, I think it's just important to make sure that we care for these clients with a lot of sensitivity. And some of these clients, girls and women, have been having these conditions or symptoms or complications for months or even years without seeking care because of, various reasons. There's lack of access to care, there's blame, there's mental health conditions. So I think it's really important to be able to assess when you're having conversations with the clients. And I just put it in 3 main key areas. I think it's important to have that initial rapport and a welcoming environment when you're having this conversation. It's a very sensitive topic. Most of the communities, any sexual and reproductive health topic is considered a taboo. So I think it's very important to really be sensitive and create that initial rapport and welcoming environment when you're initially making that contact with the client. And also when you're doing the detailed assessment, it's recommended to have a female chaperone, whether it's the mom or the sister in whom the client has agreed to have in the room during the physical exam. As you can imagine, it's a very endearing process for the client. So there's a lot of PTSD associated with it. So it's very important to make the client feel very comfortable and having any female chaperone during the physical exam. And in terms of the care planning, because it's such a long process for the management, it might take months or years for the client to fully recover. So it's really important to involve the client in their own decision-making process as part of their care management. Next slide, please. So I just put this slide up. It's really important. The subject, as mentioned before, it's a very sensitive subject to the client. And in some communities or in some societies, mutilation is not really a neutral word, because you can't really ask, have you undergone FGM or mutilation? Some people find FGM actually quite offensive and very difficult to hear because of the, the judgment from the society. Some also find the term female circumcision very controversial because it really makes them equivalent to male circumcision, which is usually normal in many societies. So it can really minimize the harm associated with it. So I think even bringing up that topic, you have to use words that are comfortable with the client. However, some people do prefer the word FGM and being direct with them. So it really depends on what your client's language and what they do prefer in having this conversation. Some women, you might be trying to have a conversation with them and they really don't know what FGMC is. You might ask, have you undergone FGMC? Have you undergone female circumcision? So they wouldn't be able to understand what you mean, particularly for also those with low health literacy or language barriers. So some of those alternative prompts you can ask is, have you been cut? Have you been closed, circumcised? Some of the other terms you can ask is, have you ever had any operations down there or been cut in your genitals? Really being able for them to make sure that they understand what you're asking. Has anything ever been done to change your appearance down below? So these are some of the things maybe you can ask or prompt for them to understand what exactly you're talking about. And just making sure that they do understand why you're asking these questions, because some might think it's a bit intrusive. Why are you asking me that? That's a very personal question. So how do you really make sure that they understand where you're coming from? So for example, you can say things like, sometimes your symptoms can be caused by something called female circumcision, just to make them aware and making them understand the reason why you're asking these questions. For example, you can say things like, particularly for the pregnant women, this is something that might affect your child delivery or even your pregnancy. So this is a question that we can ask to make sure that you receive proper management. You can also ask things like, before I examine you, I just need to check if you've ever had any operations or been cut, just to let them know that you're caring for them and not asking in a very intrusive manner. And sometimes you actually just need to directly ask, of course, in a sensitive and non-judgmental way. So you can ask things like, I know that FGMC or female circumcision is practiced in a particular country. So I think it's very important to know that your health can be affected by some of these practices. So I think it's sometimes really good to ask these questions directly, particularly if you feel like that will be the only best way to make sure that the client understands. And you can even ask something we routinely ask women from a particular country the client is from, whether they've been cut or circumcised. Is this something that has happened to you? So it's really a nice non-judgmental way of making sure that they feel comfortable in responding to you in such questions. Next slide, please. So some of the things that I think it's important based on some of the lessons learned when I cared for such clients is, of course, using a person-centered approach. It's a very sensitive topic, as you said before. So it's really important to be empathetic, really listen to them, be very sensitive when you're talking this to the clients. You might find that they've never talked about this to anyone else. So it's really important to make sure that you're really empathetic with them, speak slowly in a way that they're able to understand, and of course avoid complex medical terms. And it's very important to engage an accredited interpreter. Do not use their mothers, do not use their sisters or their family members or friends to interpret. Make sure that you use an accredited interpreter when you're engaging with clients that have huge language barriers. And I think it's also important that the client is able to understand the client's perspective, as we've talked about, engaging them in the decision-making process, and also empowering them, because some of these practices really disempower the client. So it's up to us as health service providers to make sure that we do empower them in the process of receiving care. It's also important to for them to understand that the reasons why you're asking and the reason for them receiving their care, and also the cultural and religious factors we talked about initially, just having that in mind and the context, and really being respectful of their personal beliefs and values and what they do have as some of the social norms in their society, so that you're able to navigate that very difficult conversation as well. We've talked about being non-judgmental and having to ask direct questions, particularly when you're trying to assess their symptoms for those who are doing the clinical work as well. And as mentioned before, when having the conversation, I think it's important to use an accredited interpreter and avoiding using family members to interpret, particularly if you have any female interpreters available, that would be great. Do inform them that particularly in Australia, the practice is illegal, and just making sure that we are aware of our responses and reactions. I know sometimes you can have conversations with clients and you're like really shocked, but I think it's really important to be aware that you should not make weird reactions until the client is just wondering what's going on, and making sure that we document as well. And I think it's important to understand that, you know, beyond the physical healing, it's a whole holistic approach. It's the mental health support. It's really a diverse way of providing care for these clients apart from the physical care. So it's the mental health support and linking them to other social supports they might need, like let's say, for example, domestic violence support, mental health support, family support. So it's really important to have that multidisciplinary approach and making sure that they have that well-supported care. Next slide, please. I think that's the last slide.
Yes, Moraa, it was the last slide.
Yes, thank you so much. And if you have any questions, please let me know. Thank you.
Thank you so much, Dr. Moraa, for that. So please, like I said when we started, kindly pop in your question that you may have for Dr. Moraa. When the time comes, you'll be called and those questions will be read out. The next person to present for us this afternoon is Monica Diaz, and she'll be presenting on the topic, the impact of female genital mutilation cutting education for midwives and nurses as informed by women's experiences. She's based at the University of South Australia. Monica, welcome. Thank you.
Thank you so much for the introduction, and thank you for allowing me the opportunity to provide you an update of where we're at with our research project here in South Australia. First of all, I would like to acknowledge and pay my respects to the Kaurna people, the traditional custodians whose ancestral lands I live in. I acknowledge the deep feelings of attachment and relationship of the Kaurna people to country, and respect and value their past, present, and ongoing connection to the land and cultural beliefs. Next slide, please. Female genital mutilation cutting is a global issue. A recent report by Equality Now and the European and US FGM networks identified that FGMC is found in over 90 countries. The World Health Organization estimates that 200 million women and girls have had FGMC, and another 3 million are at risk of having the procedure every year. In Australia, again, we don't have accurate numbers, but the Australian Institute of Health and Welfare a few years ago put out a report that estimated 53,000 women and girls have FGMC here in Australia. But many non-government organisations working with culturally and linguistically diverse women report that this number is a lot higher. But again, because we do not have mandatory reporting of the numbers or recording of FGMC cases, we're not entirely sure how many we have here in Australia. Next slide, please. So FGMC is considered an independent risk factor for adverse maternal and fetal outcomes, in particularly in pregnancy and childbirth, and a time when women often first report or identify that they've had ongoing health issues as a result of the procedure. So healthcare professionals are really in an ideal position working in these settings to be able to support women and identify their health needs and refer them to appropriate services if needed. But much of the research demonstrate that the people, nurses, midwives, and other healthcare professionals working in these areas do not have the knowledge and skills to adequately identify and support women, and which in turn leaves women feeling anxious and scared and very unsupported, and don't really want to engage in with healthcare services. So in 2019, I set out to find out how we can improve the education, but we wanted to incorporate the community, and particularly women who have had FGMC, because we know that there is quite a few education programs out there, but not many have actually identified the inclusion of women and the community. And our focus was here in South Australia because, unlike many of our interstate, many places interstate, we don't have a specialised service or referral centre to send women to or request support. So that's why we sort of focused here in South Australia. Next slide, please. So what I set out to do is I wanted to answer 3 questions, in particular, what factors affected the experience of women with FGMC accessing health services here in South Australia, and what were the health needs of these women, and also what impact does the education program have on the knowledge, attitude and practice of midwives and nurses supporting women with FGMC. Next slide, please. So I know this slide is a bit technical, but basically my project was divided into 3 phases, with phase 1 and 2 and 3. So phase 1, next slide, please, sorry. Phase 1, it was an exploratory phase where we interviewed 10 women with FGMC and asked them about their experiences accessing health services. And with the help, we did this with the help of a cultural advisory group. And these were members of FGMC practicing communities, women with FGMC, and health experts from Refugee Health Service here in South Australia. We were very fortunate that we were able to provide women interpreters so that they could be interviewed, so they could take part in the study. And we ended up with women from 5 different countries and communities. Next slide, please. So we overall, most women interviewed described positive experiences with healthcare services. They felt that healthcare professionals treated them well, with respect, and gave them sufficient information about their care. Women expressed complete trust in doctors because they were the expert, but they also identified several areas that needed improvement, including communication, for example, accessing the right interpreters, having more time during clinical appointments, more opportunities for continuity in care, and the inclusion of families in some of aspects of care and treatment decisions. One of the interesting things that I found was that the questions that I was asking was, originally were, what are your health needs and things like that. And I found that that wasn't really as important to women as was their cultural traditions. So upholding cultural traditions was a significant determinant of the healthcare seeking behaviours of women. Several women conveyed strong connections to their culture and a need to maintain traditions, especially those pertaining to pregnancy and childbirth. And we know that cultural traditions help women feel safe and connected to values that are inherent to their identity. And when these values are not acknowledged, as often is the case, women lose these connections and in turn their autonomy. And often they're left feeling scared and disrespected, which places them in a dangerous position because many then decide to avoid seeking medical support. So that was quite an important thing for us to identify here. Next slide, please. So then we moved on to phase 2, and with the support of a work group comprised of women with FGM, and also health experts in this field, we developed an education program, which is a 2-phase module that has 2 components. Part 1 is an e-learning program, self-directed, and part 2 is a face-to-face or online video conferencing training. Next slide, please. So this program, we are at the moment testing the site to make sure that it works well, and we're about to pilot it with vision to have it actually start evaluating it in April. Another thing that I need to add was that as part of this consultation with the community and the work group, we also developed a communication tool for safe conversations around FGMC, and that we are going to be introducing that into the module as well, so healthcare providers can have an idea of how they can safely communicate with women and how to raise and identify their health and cultural needs. Next page, please. So yes, phase 3 is the evaluation, and we're going to be looking at whether this program changes or improves the knowledge and attitude and practice and confidence of healthcare professionals caring for women. This will be done in April this year. Next slide, please. So at the moment, we will be looking for participants, especially South Australian midwives and nurses who are interested in taking part of our program. And there's a QR code there on your screen if you want more information. Or next slide, please. You can contact me directly if you would like more information about it or you would like to take part. The hope is that once we finish the evaluation, we'll be able to determine whether this program is effective, and we can make it available nationally for everyone to access. Thank you so much.
Thank you very much, Monica. Thank you for taking us along on your journey. And please, let's pop in our questions for Monica on what she has just presented. We now go straight to the next presenter, who is Dr. Ngatho Mugo. She's the Community Education Officer, New South Wales Health. Over to you, Dr. Ngatho. You are welcome.
Thank you so much, Professor O'Leary, for organizing this successful event. And also I would like to thank the team who are also helping with this. It's lovely to see some familiar faces as well. So today I will just be talking about Make Your Voice Heard, which is a formative research project that aims to understand the cultural perspective and experience of female genital mutilation or cutting among at-risk community needs as well. So we are now at the end phase of the survey. We have collected data already. I will just be sharing about some of the effective approach that we have used. So the formative research is a collaborative research project initiated and designed by New South Wales Community Education Program in collaboration with Dr. Niloy Alam, who is an anthropologist, Professor Michael Dibley, epidemiologist, Associate Professor O'Leary, from Western Sydney University, and other investigator from Sydney University. I would like to acknowledge and thank Monica Letenik, Multicultural Health Service Manager, and also Dipti Zakaria, Multicultural Health Team Manager and FGM Program manager for their support for me to conduct the formative research. Next slide, please. So who's involved in this research? Since the New South Wales Education Program is a statewide program, so we did a collaboration work with other investigators from different local health districts across New South Wales. And also we had about 10 bilingual community educators who are subcontractor staff working with the FGM program. And they were trained for them to be able to conduct the survey and in-depth interview for the formative research. Next slide, please. So based on the desk review I conducted in 2020 when I joined the FGM program, the purpose of the formative need assessment was to enable us to tailor field operation and activity to local setting and to identify and address any ineffective intervention approach, design, and concept before program is widely implemented. And we can only achieve that by consulting the community. And we want to just the specific aim of the formative research was just wanted to understand the community perception, view, and opinion about the existing practice. What are their perception view about the law banning FGM in New South Wales? What are their perception views with regard to our existing program FGM approaches? We also wanted to understand the challenges and barriers faced by the women and girls with genital cutting experience in New South Wales. Also, it was essential for us to understand from the service provider perspective what kind of the barrier they are facing to deliver the support services to women and girls and family from the FGM high-risk practices community. Next slide, please. So we got an ethical approval by Human Research Ethics Committee to conduct the research on the site. And we collected the survey data from the participants residing in metropolitan and the region New South Wales with higher number of women and girls from the FGM high-risk community, including Western Sydney Local Health District, South-Western Sydney, South-Eastern Sydney, Nepean Blue Mountain, and Hunter, New England. So these are the sites that we collected our data across New South Wales. Next slide, please. In order for us to capture a broader community perception, view, and experience on FGMC practice, and also information related to the existing FGM program approach, the study participants included mothers with genital cutting experience, age 18 and over. Also wanted to hear from men as well, as a husband of women with genital cutting experience, but also wanted to know and to hear perception view of the young people that might be born here, but they are from, they have at least parent from the high-risk practice community who are aged between 18 and 30 years old from the affected community. And also the formative research study participants also include religious and community leaders, community and light health workers, school teachers, bilingual community educators as well. So these are the participants that we wanted to hear from them to have a very wider view and perception with regard to FGM practice. Next slide, please. The research design that we have used a mixed method research design involving a structured questionnaire, which has been developed and designed by the UNICEF, and we have modified these to meet the needs of the community, and also a qualitative exploration in proposing the selected community to generate a mixed method data that will assist for designing or modifying the strategy and engagement approach of New South Wales education program. So we, as I mentioned earlier, we trained our bilingual community educator. We generate the surveys meant to be online, and there's two types of the survey. One, the first surveys is addressed to women, men, and young adults, and the second survey is addressed to religious and community leaders, workers, allied health workers, and service providers. Each of our bilingual community educators who have a unique QR code that they're able to share with their community, with their network. But also we understood that the illiteracy among the community, so there's a support for language support that the BCE are able to organize a meeting and work the participant through the questionnaire. So we have about 5 or 6 language support available for the community who are unable to who have literacy issue. And then we also have the in-depth, we wanted to understand the mostly why behind the numbers. And this is, we had different in-depth interview guides addressed to women and girls with genital cutting experience. We have a guide, different guide also for men to understand the perception view with regard to practice of FGM. And also we have some of the key informant interview with the bilingual community educators as well. So this will give us a broader picture. We'll have some baseline from the survey, but also we'll understand the why things are happening within the women, why they practice, what. So this will give us almost inclusive picture with regard to the FGM practice. Next slide, please. So this figure just shows us the data collection approach that we have used to collect data from service providers, legacy and community leaders. So we generated a list. This took place last year from February until the end of the year. So we have a list of potential participants that we sent the survey link via email twice a month. And also we have identified about 30 schools in the area that with high number of participants from the FGM practicing community. We also use different opportunities such as like African leaders meeting. We did print the hard copies, and also we have the QR code that we are able to share with them as well. Next slide, please. So this is just the process, show us our consistency throughout the February last year until August. So every month we sent email twice to all the service relevant providers, legacy and community leaders. And currently we have about 108 completed survey through the providers. Thank you. Next, please. The approach that we use with the community, we have to modify our approach. The initial approach is online. So we send the link, we share the link, each unique link with our bilingual community educators for them to share it with their community member, could be through the WhatsApp or the Facebook or different media that they used. But it wasn't really, as we can see from the figure, like it's only 66 people where we were able actually to do them online. Majority of the approach that we use is the best approach was during the community event. So we went there, we print the survey, and when we hear there's a community event, we set up a table, and the community were very responsive. So we were able to get a lot of our survey done through the community event. Also, our bilingual community educators, they took even extra mile. They went home visit, drop off some of the hard copies to the community, to their members and the network. And they once the community have completed the survey, they pick it up from them. So this is also was the best approach. And also during they also conduct session, information session. And through the information session, they're also able to promote, and also women are able to also complete some of the survey. Some of them, it was a difficult little bit, but some of them also have done it through the telephone, scheduled a telephone interviews, and they work the participant through the survey. Next slide, please. So currently we have about 414 survey completed by the community, and it's vary between like from people from Sudan, like about 100 of them participants completed, to 8 in Ethiopian communities. And this is just based on also we have some of our bilingual community. We have more bilingual community educators in certain ethnicity than the others as well. And it's some ethnic group also harder to find as well. So this is, so this is our, we're able to collect about 414. Next slide, please. And just, this is a quick update. So if you'd like to hear more about the result for the FGM. We are also hosting International Days of Tolerance at the end of this month. And if you are around New South Wales, you're most welcome. The QR code is still not inactive, but tonight will be active. And I will share this, I will share the flyer with Lady and also with Rani as well, and then can redistribute it. Thank you so much for having me today. Thanks.
Thank you so much, Nath, for that. I will quickly hand over to Adis now, who's going to take us through Q&A for the first part of today. We still have the second part, so please, we still have the second part containing so many other insightful content. But over to you now, Adis, please, for the Q&A.
Adis, you're on mute. All good.
Apologies for that. Thank you very much to the speakers for their presentations. As Dr. Olaide has mentioned, this is in our Q&A session. I've just gone through the chat and I've seen some questions have been answered, but I do have a question for you, Dr. Ngatho. Can you please share one lesson that you have learned from conducting this formative research with the community?
This is a good question. I think like with the data yet, I haven't went through, but the process, the lesson I have learned that is have forced us to actually be where the community is, and also just to be able to attend the community event, and also just to hear from the community as well. But the lesson we learn more is about you might have a certain approach that you think that this is what will be the best. So we thought that we will do this was online. So we develop it. We develop the questionnaire. We have the platform, which is really excellent at every single thing. But we have to respond to the need of the community as well. So what we learned that we are able. You have to modify yourself. You have to be flexible. You have to be patient. You have to be also respectful when you are dealing with the questionnaire. They're quite sensitive as well. So we have learned a lot from the community. So this is what I can share.
Thank you very much for that response. Just go through the chat and see if there's any question. All right. As I wait for people to pop the questions, Dr. Moraa, I do have a question regarding patient-centered communication. How can you see that being integrated into healthcare as it pertains to looking after women and girls who have undergone FGMC?
Thanks, Alice, for that question. And I think it's been mentioned a bit with the speakers. I think my perspective, there are two components. I think it will be educating the community, first of all, to improve their health literacy, as well as educating the health professionals, and not only health professionals, but also, social service providers who provide not only the clinical support, but also the other social supports. So I think those two components, integrating training, for example, in the clinical spaces, integrating the training in all the social support services that provide support to the clients, but also really having those community engagements with the community, I think, and utilizing some of the data from all this wonderful research that's happening, just pinpointing the priority communities to have those community engagements and training, and of course, having investments from the government, either in terms of financial or advocacy and all that stuff. So I think having that community aspect, but also having the trainings for health professionals.
Thank you very much for that response, Moraa. Do we have any more questions from the audience? Thank you, Angela, for sharing that, the link for the patient-centered communication. Angela has just shared something regarding patient-centered communication in the chat. Okay, if we do not have any more questions at the moment, we're going to take a break now, and then we'll come back for the next.
Alice.
Hello.
Hi, Alice. Sorry, I tried to. I tried to be connected through the computer, but for some reason it didn't allow me, and it took me a bit of time as well. We got a bit of problem with the fridge. Anyway, unfortunately, I missed the presentation. But what I wanted to ask is, who the relevant is how active the education about FGM is conducting especially in those countries they practice FGM. Did you get my question?
Yes, I'll direct that question to either Dr. Moraa, Dr. Ngatho, or Monica.
Do you mind repeating the question again? Sorry.
Yeah, my question is, how active is the education to stop the FGM in the countries they practice going? Is it actively education done? What other options to stop is implementing in this country, for example, in Eritrea, Sudan, if there are other countries as well?
Maybe I can speak for Kenya. So for example, in Kenya, where we cared for some of the clients who experienced this in their society, there's a couple of different opportunities to educate the community. Of course, we do not have massive resources, but I do know, for example, the Kenyan government has partnered with other organizations like, UNHCR, particularly where I was in Kakuma. We did have some projects funded by UNHCR, for example, to target community engagement and education to reduce FGM, and also the Kenyan government did put in some money to some projects, particularly focusing those areas that had a high density of population of communities who practice this. So there's been a bit of work done in that space for quite some time, using different opportunities and different channels, but of course there's always room to do more. Thank you.
Is there any law, for example, in Kenya, that if somebody's practice this FGM, the government take action, or
yes,
just based in education?
Correct, but based on my understanding, FGM is illegal, for example, in Kenya. So anyone who's found conducting that will face legal action. But of course, we do know that some community members who come in from other countries, for example, who've already undergone FGMC, for example, so you also still have to care for them, even if they've already had FGMC, but it is illegal, and anyone who does it in Kenya, for example, will face legal actions. Yeah.
Thank you very much, Dr. Moraa, for that response. If there are no other further questions, we're going to take a short. Okay, so we've got Nagat Abdallah. Yes, you can see you. Do you have a question?
Thank you so much for this really useful presentation. This is my first time to attend such an insightful and informative session about the FGC. I'm from Eritrea, and I know what does this practice mean, because I came from a family who practiced this FGC, and maybe the very harsh one, the very harsh type. So it's not a question. I just want some clarity from you guys. How can I describe, or I don't know what is the word, how can I put things together, word together, to differentiate or to explain for someone or for a group of people that FGC practice is not a family violence, or not because the parents are violent or because they hate the girl or the daughter, they are practicing this. You know what I mean? I'm new in this platform. I joined FARAP just recently. I was working with the community in some other areas. So I really want to have that awareness of how I can myself differentiate that my mom and my father, when they practice this to me, not because they hate me, and even other areas, still they are practicing this, not because of family violence or not because the mother is an ugly, aggressive mother that she's doing this. They're doing this because they inherited similar, you know, it's something deep rooted into them. Yeah, you understand what I mean, guys? Can someone just give me some insight or provide me with some useful wording to put things together when it comes to this practice and violence?
Monica, are you happy to answer the question?
Yes, I certainly can, and I welcome anyone else who would like to add to it. I think it's a very difficult, in a way, a little bit difficult to, I guess, for people who are not part of the community to understand the reasons why such a practice is conducted. One of a person that from the community once told me that it's kind of like choosing a school for your child, where you choose, you know, you try to provide them with the best sort of opportunity in a way. However, the thing is that when we put it that way, we can understand it, but FGMC has no health benefit for women and girls, and I think that's the important part to say, that it is not necessary for women and girls to undergo the procedure, that there are other things that that women can, I guess, education is very important. Yeah, I don't know how else you would put it. Rani, I think you've got some insight into this. I can see your hand up.
Thanks, Monica. And thanks, Nagat, for this really nuanced question. Can you all hear me okay? Yeah.
But can I ask you, hello, Adis and others, hello?
We can hear you, Rani. Yeah.
Hello?
Okay, sorry. I think that's is that Saba again?
Yes, somebody asking. I have. Can I ask the clarification? Is that the question is how we educate for those people they practice the FGMC? It's not because of hate. It's because they think it's good for us. Is that the question?
I think so, Saba. Yeah.
Mm.
Yep, sorry. Hi, everyone. My name's Rani. I'm the Senior Project Officer for NETFA. I'm conscious of time, but I did want to just touch on what Nagat was asking about. This is actually the approach of explaining that the procedure wasn't done out of hate, but instead out of love and out of care for the child is one of the topics that we are discussing in the NETFA Fresh Voices on FGMC podcast series, which we will be launching after the break. So thank you for raising that point, Nagat. And I just want to encourage you to listen to one of the podcasts in particular with Margaret Mateo Bacco, who is one of the graduates from our leadership program, who talks specifically about this point, that having that lens of care and love on the child rather than forcing the child to undergo the procedure out of hate. That being said, I do also want to acknowledge the complexity of each individual's experience of FGMC, because in some cases, there are people who are forced to do the procedure, and it causes a lot of harm and trauma. And so I suppose one of our intentions with launching a series of complex and human stories on FGMC is to capture the nuanced experience of each individual, each family, and each cultural or country background, if that makes sense. So I want to acknowledge what you're saying and also acknowledge how complex each individual's experience of FGMC can be. I'll just pause there and hand it back to Adis.
All right, thank you so much, Rani, for that. We do have another Q&A session much later, so we're gonna pause here and have a break for about 10 minutes, and then we'll resume the 3 minutes. Irina says 3 minutes. Sorry.
Yeah.
Okay. 3-minute break, and then we'll come back and resume the session.
Thank you.
Thank you very much.
Irina, do you want me to play some music, or actually you need to play some music because you're screen sharing.
I will, yeah, just a second.
Thank you.
My playlist was gone. I knew it would happen.
All good, all good. Could I just get a sense if everyone's ready to come back, please? You can put that in the chat, or you can turn on your videos, everyone. Great. Olaide, did you want me to get started, or how would you like to go about this?
Yes, Rani, please get us started. Thank you.
Sorry, quick sip. Thank you so much, everyone, for the excellent presentation so far and amazing questions and conversation. My name is Rani Pramesti. My pronouns are she, her, and they, them. And I'm the Senior Project Officer for NETFA, which, as Olaide has already said, is the National Education Toolkit for FGMC Awareness, which is a project coordinated by the Multicultural Centre for Women's Health. Next slide, please. So I thought I'd just give a short introduction to NETFA. We are an Australian project funded by the federal government through the Department of Prime Minister and Cabinet. And I also just want to acknowledge some of the language that that is commonly used when talking about FGMC. One of the things that I'm still thinking about in my role is how to have more gender inclusive language on FGMC. So I want to acknowledge that there is a lot of emphasis on women rather than people affected by FGMC during today's presentation. And there may be people affected by FGMC who do not self-identify as women or girls. And in fact, in this role, I know there's at least one person who expressed their interest to be involved with NETFA who self-identified as non-binary, for example. So I just want to acknowledge that the language being used in a global sense and including in Australia may not be perfect and may not be the most gender inclusive language. And we are very open to feedback on this if anyone attending today would like to have that conversation with us. Next slide, please, Irina. So one of the main activities for NETFA from last year was the delivery of our inaugural National Leadership Program. So for this program, which ran over 7 months in 2022, we shared 3 forms of knowledge and skills with women affected by FGMC in the Australian context. And the 3 forms of knowledge were firstly, knowledge about FGMC, of course, and then secondly, structural frameworks. And what I mean by that is we talked a lot about intersectionality, we talked a lot about gender inequality and so forth. And finally, we shared storytelling skills, specifically in how to create videos and podcasts on FGMC. Next slide, please. So that's enough for me, and I actually want to introduce everyone to one of our NETFA Leadership Program participants, Sarah Yusuf. Sarah, I'm pretty sure this is you. Yeah, yes, hi. And we're going to hear from Sarah for a few minutes now about her experience of the program. Go ahead, Sarah.
Thank you, Rani. Thank you, everyone. Good afternoon. My name is Sarah. I'm talking to you from Brisbane. I would like to acknowledge the traditional owners of the land that we met today. Just want to talk about my experience in NETFA program. It actually was a great 7 months that I did with NETFA. The best thing I would like to talk about is my knowledge about the FGMC before and after. It's actually improved a lot. It's given me more confidence to talk about it. It's always been a taboo a topic we couldn't talk. It's there, it's in the community, but we can't talk about it. I actually learned how to share with the community, how I address their concern, how I read the problems that they actually lead into the future. It's not just today or a past problem, it's actually ongoing problem. By the time that we learned during the program, it's touch on the how sensitive it's the topic and how we need to be careful to talk about it. We learn everything. We learn how to speak with journalists about it. I think between the past and now, when I say the past, the earliest when the program started and now, I feel I can talk and I can educate and I can talk to clinicians and pass this information, what I learned, and pass the concern from my community to them. I think it was a really great program and it's very an honor to be with them.
Thank you so much, Sarah. And I'm looking forward to keep working with you because I know we're going to co-host an event with you and clinicians based in Queensland at some point this year. So thank you so much.
I'm actually looking forward to it because this is my first experience after the graduation. And I really I can't wait to start. I'm not sure how that's gonna be, but then maybe I need to back to our session. It's like maybe the first one will be hard, but then I believe it's gonna be great because it's needed to be it's really needed to be educated. People need to know more about it, and it's need to be heard and stop from being a hush-hush topic to something that people can learn from it and hear how bad those women's life was, and still with the health issues that they having at the moment. So I'm really looking forward to it.
Thank you. Thanks, Sarah. Thanks for sharing your experiences today. And shout out to our partner at True Relationships in Queensland as well. All right, I'll just remove your pin, Sarah. Next slide, please, Irina. And yes, round of applause for Sarah. So everyone, today is a very exciting day. In order to mark the International Day of Zero Tolerance for FGMC, NETFA at the Multicultural Centre for Women's Health, we are launching this new podcast series called Fresh Voices on FGMC, a podcast made by women from communities in Australia affected by female genital mutilation or cutting. So this podcast, I do just want to acknowledge, was co-created with our partners at 3CR Community Radio. So shout out to anyone from 3CR who may be here today. Next slide, please, Irina. So just briefly, there are 6 podcasts in this new resource, and they capture really diverse, and I want to add actually really human perspectives on FGMC. And we will be listening to excerpts from 3 of the podcasts today. So podcast number 1, we've called A Survivor. Obviously, it's from a testimony of a survivor, a victim survivor of FGMC. Podcast number 2 are the perspectives from a community advocate who has been working with communities affected by FGMC for over 17 years. Podcast number 3 captures the perspectives of a GP and her thoughts on bodily autonomy. Podcast number 4 captures the experiences of a married couple on the impact of FGMC and how it has impacted their relationship, as well as the long-term effects of FGMC. Podcast number 5 is A Family Divided. Now, this podcast tells the story of how there were different beliefs and attitudes about FGMC across different generations of this person's family. And finally, podcast number 6 is another perspective from a community educator, or in Bahasa Indonesia, seorang pendidik masyarakat, and is an informative podcast about the impacts of FGMC. Next slide, please, Irina. So before we get stuck into the podcast, we have a very exciting testimony from one of the hosts of the podcast, Patience Afor. Patience, are you here? I can see you. I'll just add. Patience, can I check that you're here?
Yeah, I am here.
Oh, great.
Yeah.
I can't see you, but I can hear you.
All right. I'll make the video.
Sure, if you can.
Start working.
Oh, yay. Hi, Patience.
Can you see me now?
Yes, yes, we can see you.
All right.
So, Patience, oh, sorry. I'll just bring you in to introduce yourself if you like.
Yeah. All right. Hello, everyone. My name is Patience Afor. One of the ladies that Rani and Irina took on a long journey, seminars and lessons last week. Yeah, I am here to testify actually what I witnessed and my experiences. Thank you.
Thanks, Patience. I do just want to say, I think you mean last year, because if we ran the program last week, we'd all be very tired.
But, last year.
Yeah, all good, all good. So, Patience, I wanted to ask you, why did you join the NETFA Leadership Program?
All right, Rani. First of all, before I answer that question, I respect the past and present of the Aboriginal people who let me or who let us have part in their land. And I am talking from the Ngunnawal country here in Canberra, ACT. So I joined, anyway, I'll have to give the content warning. My words may be a little bit not smooth to hear, or it may be a little bit triggering, but I plead, bear with me. I joined the NETFA Leadership Program through a nurse of women's health here in Canberra, Faye, who introduced me to the group after attending her health clinic. This made me to remember the suffering I witnessed years ago when I started my teaching career in Cross River. I think some of the African people there will know where Nigeria is, and they will know, or they must have heard about Cross River in Nigeria years back, in rural community where FGMC was practiced or is still being practiced. The girls there were caught with unsterilized, rusted, unclean, and even blunt tools. These were used on them to cut innocent girls in the name of carrying out a culture for their parents to be proud of belonging to that society. Because if parents do not approve it, automatically the community will expel them and there will be nowhere to be found. So parents, in tears and in pain, give these things, and some will be proud that, yes, my daughter is now circumcised. I am now a fully mother of a circumcised child. The night of this cutting, bleeding, crying, shouting, and screaming filled the community. Since then, with a heart broken, I vowed to help if there is a need or if there is a way to help. This is the opportunity. For Faye to introduce me this, I decided it's an opportunity to study and help these communities. Thank you, Rani.
Thank you, Patience, for sharing that story. Another reminder to everyone here, if you found that story distressing, I think Irina can copy and paste some of the mental health resources you can access, and you are welcome to take breaks whenever you need to. So Patience, I know in your podcast you interviewed a couple and they went by pseudonyms, or it's not their real names, Victoria and Chris. And I wanted to ask you, what is the key message of your podcast interview with Victoria and Chris?
Thank you, Rani. The key message I would like to share with this group is, with Chris and Victoria, include sharing with people. They should be educated. I am sharing with people, the rural area, the affected women, that they should be educated about FGMC. It has caused more harm than good. I would like the culture to stop, and women or girls should be discouraged from this, as well as parents who are really into this, to stop pushing their daughters to pass through this.
Thank you, Patience. That's a really clear and powerful message. And finally, Patience, how do you want to make change on the issue of FGMC?
Thank you, Rani. A lot, but just a few I will discuss. One, I would love to make changes in the following ways: attending seminars like this we are doing today, attending seminars and involving and encouraging victims, the ladies, to attend. Yeah, the people around me to publicize that FGMC is having such a thing today. If they could please join us so that they will get more awareness. Forming helpful groups where we can be sharing our views with them, so that they can as well carry the information to others, like having maybe WhatsApp chat, WhatsApp group, Facebook group, and all the rest, Instagram and all the rest of them, having such groups so that we can as well educate and encourage the educators to carry the news or the information to others. Last, or second to the last, having meetings with parents, girls, and community heads, as well as health officials from time to time, and communicating the outcomes of the meeting. If they are available, then have meetings with them, discuss these things, that they are not too good, they are not too helpful. We've lost a lot of women through this. And last not to the least, then the victims should be given FGMC websites so that they can actually go there, make free calls, then send messages when they are stressed. Thank you, Rani.
Thank you, Patience. Thanks for your powerful messages and testimony. And that is also one of the reasons why NETFA exists as a national resource. So if anyone's interested in the resources, of course, the podcasts are one of them. Please go to netfa.com.au. Irina, I think we're ready to move on. And thank you so much, Patience. So just a bit of a content warning, everyone, before we do play excerpts from the Fresh Voices on FGMC podcast series. So all of these things will be discussed over the next maybe 15 minutes or so of content. The short-term and long-term impacts of FGMC, including physical as well as mental and emotional impacts. And then we are also going to be playing excerpts that describe unhelpful experiences with healthcare professionals in Australia. Next slide, please, Irina. So the first podcast we'll be playing is Patience's one, where Patience interviews a survivor of FGMC who would like to go by the name Victoria, and her husband who would like to go by the name Chris. Go ahead, Irina.
Hello, and welcome to NETFA podcast with myself, Patience Afo, participant of the NETFA Leadership Program. NETFA is the National Education Toolkit for Female Genital Mutilation, Cutting or Circumcision Awareness, which is a project coordinated by the Multicultural Centre, Women's Health. Before we begin, I would like to acknowledge that I am joining you all today from Nanowal, country of Canberra, Australia. I would like to pay respect to elders past and present. Content warning. This podcast contains important stories and conversations about female genital mutilation, circumcision, cutting. Some listeners may find this triggering. Support is available on the NETFA website. Please go to netfa.com.au or contact the Multicultural Centre for Women's Health on free call 1800 656 421. Today, we are joined by a very special guest, Victoria, who will be sharing her experiences of female genital mutilation or cutting.
And Irina's just going to skip to the next part now. Thanks, everyone. And thanks, DJ Irina.
In terms of knowledge.
When did you first experience this female genital cutting?
I witnessed this when I was 15, and this was done, organized by my parents, as it is a cultural thing where I come from. It's part of parents' pride. For the parents, it's their pride, and it's part of your marital right as well. Because if you get it done, then you get married or you miss out on one. So it happens annually, depends on your age. So if you miss out on the previous year, if you're in the age bracket, then you get rolled into the next year. So it's something parents definitely want you to do because of what the society wants. So this happened at that stage of my life where I already know pains, I already feel pains, I already know the difference with pains and non-painful things. So it was really a horrible night for me. It was really a horrible day for me. Not just a day, it's something, the pain that continued for weeks, something that you do and you bleed for days. It's something you do and you feel so depressed for weeks and months. So, yeah. So,
And we have just one more excerpt featuring Victoria before we will go to Chris and his perspectives.
Victoria, sometimes I hear some ladies saying that they do not enjoy sex with their husbands because of the pain or the blocking of the canal. Is this as well applicable to you?
it's something that has to do with, it causes low libido in females because that part of you that was cut off affects your sexual life, you see? And because this area has been tampered with, if there was keloid around that area, you could imagine the kind of pain this person has to go through in an area where there is a keloid. So you find there's so much pain when you're having any sexual intercourse. You feel so much in between the time. You can even start spotting, like blood spotting. You could feel the pressure on you. So it's always terrible. You can, my husband, Chris, can always, talk about his experience as well, because it hasn't been easy for both of us to, in terms of sexual relationship or sexual intercourse. Yeah, it's really, really terrible.
Thank you. So now we'll be moving on to perspectives from the husband, Chris, who also moved to Australia from Nigeria. And both Victoria and Chris, as you can hear, really generously share about their experiences. Go ahead, Irina.
Chris, thank you. Please, Chris, Can you tell us a bit about yourself?
I work as a mechanical engineer in Canberra, but I traveled to Western Australia for a business proposal. I grew up in Imo State, Eastern Nigeria. I came to Australia for adventure and also study, and then get to experience the different cultures, as I've been hearing over the news that Australia is a multicultural country.
Great, Chris. I have discussed at length with your wife, Victoria, the experiences she has had as a result of FGMC. I would love to hear about your perspectives on this practice.
In all honesty, it hasn't been easy since I got married, as it is part of our culture in those days for women to be circumcised without the knowledge of the implications it will cause in the near future. I got married to my wife. She's circumcised, which is demanded by culture, and it hasn't been really easy. For example, if we want to make love, sometimes I lose the interest because of the pain. The pain I know my wife is gonna go through as soon as we start. Secondly, it's randomly she gets a lot of pain, even sometimes during urination because of UTI, as circumcision also creates a lot of room for infections. So in all honesty, it hasn't really been easy.
And the final excerpt that we'll hear is Chris's answer to the question, how can men be part of the movement to end FGMC? Go ahead, Irina.
Then how can men be part of this movement that we are making to end FGMC? Please.
Yeah, okay. I will urge my fellow men who are learned. At least this is the 21st century. There's a lot of materials to acquire knowledge, and I believe so much that the youth these days, they are more advanced when it comes to technology. I will urge my fellow men to carry out research, to ask questions, using my own experience as well, to join hand and fight this particular part of the culture, which it's not only harmful, but detrimental. To fight and say and work hard for this to be abolished, so that when they themselves get married, they wouldn't be experiencing what I'm experiencing. Thank you.
Thank you so much, Patience, Victoria, and Chris, for that really powerful testimony. So I encourage all of you to please listen to the full podcast. This is the one called A Couple. And I will share the link to the podcast page after this presentation. So now we are moving on to the podcast number 1, which is called A Survivor, which again is hosted by one of the NETFA Leadership Program graduates, Josephine Sharif. Josephine, I think I saw you in the room, so big hello and thank you for your work. So in this podcast, Josephine interviews a survivor called Badanya. Again, that's not her real name. And this person did not want to be interviewed live for the podcast. So instead, I've stepped in as a kind of voice actor. So Irina, please go ahead with the first excerpt. Thank you.
Would you like to introduce yourself to let our listeners know where you are from? Bandanya, your country, what do you do for a living, whether you're working or studying, and if you have children?
My name is Badanya. I was born in Liberia.
escaped war in Liberia and went to Sierra Leone, and later went to Guinea to stay with my grandma and auntie. We spent a lot of time in Guinea in refugee camps before migrating to Australia in 2008. I have 3 children, one born in Guinea, a girl, and 2 boys in Australia. And we're going to skip forward now to when Badanya had her first experience with a health professional in Australia. Go ahead, Irina.
So, Bandanya, what happened when you arrived in Australia with all the checks with the medical professionals, especially when you became pregnant? This must be different from your first birthing experience in your home country. What was your experience with the medical professionals?
When I arrived in Australia, my first encounter with a health professional was when I went for my first cervical screening with my GP. That was where they started asking me about the scars down there. This question keeps coming up throughout my pregnancy journey, but I have never given any explanation of this question to any medical professional, because I did not want to bring back bad memories to me. It was in the past now. Also, it is taboo in my culture to discuss female circumcision with women who have not embarked on that journey. You cannot talk to men about it either. With this fear in mind, not to talk about the scars, I sometimes feel overwhelmed, anxious, and will skip my antenatal appointment. Come to think of it, I have lost relationships because of not sharing my experience in that space. To be honest with you, I did not experience any medical doctors, nurses, or male partners asking any of these personal questions in my home country. So, this was an overwhelming moment for me. This made me feel ashamed, angry, traumatized, frustrated, negative reaction every time I think about it. Also, I didn't know whether it was appropriate to let the doctors or nurses know that this question was not going down well with me, for fear that they might refuse to look after me. This has been a difficult journey for me throughout my pregnancy, you know? So another big thank you and round of applause to Josephine and Badanya for sharing such vulnerable experiences with us. The final podcast which we'll be listening to is by a community advocate, another graduate, so Margaret Mateo Bacco, who shares more than 17 years experience supporting communities affected by FGMC. Irina, given we're running a little bit over time, I think we should jump straight to 5 minutes 41 seconds and just play from there. Does that sound okay? Yeah, so go ahead, 5 minutes 41 seconds, which is when Margaret talks about how, so firstly, Margaret shared about the difficulties that she has had working with health professionals. And then I asked her, how do you think health professionals can bring up FGMC safely with community members, which we've touched on. There's been a bit of a thread, I think, throughout today's presentation. So go ahead, please, Irina. And how do you think health professionals can bring up FGMC safely with community members?
I think the health professionals should have an idea of how to approach people. For example, they can ask a question like, we understand you are coming from a country where, or from Africa, where female circumcision is practiced. In your country, do you practice female circumcision? If so, did you go through, and what type did you go through? What type did you have? And please don't use the word mutilation, because this could be can offend some community members. And do not just assume because I come from that particular country, I'm circumcised, because in one country, some group can be circumcised and some group are not circumcised.
That's a really important point. And in your friend's case, the one who had a cesarean, What other options do you think should have been investigated?
In my friend's case, what I know for sure that there was a language barrier, and then they used the husband as an interpreter, which also make it very difficult for the woman to talk about her experience, because she can't, in our culture, you can't just go talking about things like that in front of how you feel about your private part to your husband. We don't do things like that. I think they should have provide my friend with interpreter, or also the midwife. They should refer her to the midwife so that the midwife can deal with her and ask her question and explore, what my friend have been through, which type did my friend have, does she need operation or she doesn't need to have cesarean. And also they should have explained to her that, because of the type of female circumcision you have gone through, we are not equipped to undo it. So we are going to go through with the cesarean. In that case, at least she understood, yes, they can't, but they've explained things to her.
Thank you, Irina, and thank you, Margaret, for such concrete suggestions that health professionals can take into our work. I'm going to bring Adis and Olayide back on for our final Q&A session. Thank you so much, everyone, for listening.
Thank you, Rani, for that. We're now going to conduct the second session of the Q&A. Before we went to break, I think Fatu and Mama Saba had raised their hands up. Fatu, did you want to ask your question that you... Or Mama Saba? Okay. In that case, I'll move to the chat. There was a question popped in here by Rosemary Hannah. I think the question has already been answered, but I will still ask it. Let's see. So Rosemary, as FGM affects mostly women in your quest to get rid of this practice, have you also involved men, and are the men who support this? And if so, what have you done to include them to make the fight more effective?
Can I ask, Rosemary, was that question directed at myself or any of the other speakers?
I think it was just, no, she hasn't mentioned who it was directed to, so anybody is free to answer.
Okay, so I mean, I can start us off, and then if other people want to add, please feel free. So NETFA, one of our activities is a national partnership across Australia, and there's definitely men involved in our advocacy and education work there. And I think it's a really great sign that the UN theme for this year, as Dr. Olayide announced at the start, involves partnership with men and boys. And it was a real gift for us to have people like patients connect with Victoria and Chris, for example, so that we had at least one man's perspective on how this has impacted him personally and impacted their marriage. So that's one of the ways that NETFA has involved men, is of course through the podcast series, but also through our national partnership framework, which includes male community educators and health professionals as well. Because we agree, Rosemary, we need to involve men in ending FGMC. I'll pass it on to anyone else who would like to add. Thank you.
Thanks, Rani. I also responded to that question as well, along the same line of what you have said, that our initiatives work closely with men, looking at being guided with the international theme for this year, and also the voice of Chris in the podcast, as well as some of the photos that were shared by Dr. Na in her presentation. And really, we thank you for bringing that on board, because it's further emphasizing the need for us to continue to engage with men and boys. So thank you.
Thank you so much for that, Rani and Dr. Olaide. I can see Mama Saba has raised her hand. Mama Saba, please go ahead with your question.
My question is, sorry, because I didn't start with it, that's why I'm a bit confused. I try to gather the ideas from the latest presentation and speakers. Of course, as I am one of the survival of the FGM, but also as I am the activist against this practice, not only when I came in Australia, but from very early age when I was in my country, when I was in Sudan. And here in Australia as well, especially in Queensland, I was working as educator with the Family Planning Queensland. I think now the name is changed. But for a while, when of course the what they call it, fund probably stopped, if I recorded it well. That practice, I don't have, I mean, that program, I didn't hear about it. Is it the education still continue? If it is continue, I don't see in my community, at least in the Eritrean community. I'm a bit active as well within the African community, but to make sure in Eritrean communities, Eritrea is one of the countries that we practice FGM across the culture, across the religion as well, Muslim, Christian. Of course, the kinds of practices differ. For example, in Highland, Christian is only the cut, the other are with the other type of circumcision. So my question is in Queensland, the education is happening? If so, which department or which organization is doing it? I hope my question is clear. Hello?
Yes. Sorry, should I call you Mama Saba?
Yes.
Yes, okay. Hi, Mama Saba. Nice to meet you. I've heard a lot about you. Jana from True Relationships in Queensland has put in the chat that if you are interested in education in your community, to please contact Jana. And Jana's put their email address there. And True Relationships, I know, published a new education module, I think last year. Did you want to speak to that at all, Jana? Because I think you're more familiar with the Queensland context, and I know Addis is as well. Jana, is that okay? Sorry, I know I'm putting you on the spot a little bit here. Okay, Jana's having mic or camera issues. That's okay. I think one of the organizations active, Mama Saba, is True Relationships in Queensland, and also Mata Refugee Health. Excuse me. Addis, did you want to add anything? I know you're more familiar with Queensland, so.
Yeah, Mama Saba, so as Rodney has said, yeah, get in touch with Gianna. I'm also happy to meet with you, like I spoke to you the other day. And I told you about FGMAA and the work we're doing to raise awareness around FGMC as well.
Yeah, I'll be very happy. I mean, as I said, of course, it doesn't mean that I'm not doing it, because that's my core value or passion that as I stand for women, women's rights. I am against it. I talk always, whether in my church or in a way, anyway, I meet with my community. But as I mentioned, I don't see it, of course, the regular education as we were doing years ago when I was working with the family planning Queensland. So, which is very important because now the community is growing. There are a lot of new arrivals, and it's very, very important that to provide a regular and formal kinds of education. One, of course, not to practice it. Two, to understand, to be aware. The other thing is, of course, they need to know what is the law in this country as well, not to get them in trouble as well. But of course, my interest is people to be conscious of that. This practice should be stopped, and then special women, they should stand against it.
Yeah.
So I will be happy to do them.
Yes, Mama Saba, I would love to stay in touch with you. And one more thing I'll add is 2 of our graduates from the NETFA Leadership Program is based in Queensland, and we are intending to keep working with them. Sarah is one of them. You saw her speak earlier, hopefully, and we are going to keep working with them, including through education programs. So please, we'd love to stay in touch. Please share your contact details either with Adis or with myself, and I'm sure we can work together.
Adis has all my contacts, so
great. So I think we can work together in the future, hopefully.
Thank you.
Thank you.
Thank you, Mama Saba and Rani, for that. Ishraga, you've got your hand up. Would you like to ask your question?
No, I don't have a question. I'm just adding to what Mama Saba asking about the awareness. Can you hear me?
Yes.
Yes, can hear you.
So I'm from Queensland here, Townsville. I work with QPAS organization. I also done FGM workshop for the women and from different communities here in Townsville. And I just did it to see, because I'm from Sudan, we practice FGM, and also women here from Central Africa, new arrival from Somalia, from Liberia, from different countries, from Nigeria, from Egypt. So we did workshop, and where I found it's most of the women here are really against it, and they really understand it's not a religion, it's a cultural thing. So they do it they doing a lot of awareness and advocacy for the girls as well. So they all said like they are not gonna done it for the girls. So that's what I see here in the community in Townsville. Yeah. Thank you.
Thank you so much for sharing that, Ishraga. Just quickly have a look at the chat and see if there's any more questions.
And this also a bit of a time check. Yeah.
Do we still have time for one more question, if there is?
Personally, I don't think so, because we want people to do the evaluation.
Well, okay, no worries. Then I'll conclude the Q&A session, and thank you to everybody who's asked the question and for the responses as well.
So great to
just add this one question, probably suggestion rather than question, for the people they run the education and everything. I think for me, we need to have an open discussion kind of through the open platform like television, stuff like that, in discussion, whether a number of times in a year. This is very important because it's not only what the genital mutilation, but the psychological effect for the woman. We need really to show the courage to discuss this, and then openly everybody to know, not only quietly like we used to do it, go to the community, the woman, educate, but we need to have open discussion, everybody to know about it, and then of course to create a wider awareness, and then to make it stop. So do you have such program? what do you think if we do have, is there any access? Sorry.
Thank you. So maybe I can respond to that question. Thank you so much, Mama Saba. That's a very, very important point you have raised. For example, this annual event will be held every year. And apart from that, there are programs that are being run by NETFA. And I believe that with many interests that today has actually generated, the organizers of this event, which is Western Sydney University, NETFA, and FGMAA, we take your suggestion on board so that we can have regular events, work together with the media, and see that the message is out there. So thank you so much, Mama Saba, for bringing that up. We're just going to finish in the next couple of minutes. And the only last thing we'd like you to do, everyone, thank you for staying behind, is to provide us with feedback for today. Irina, please, can you share the next? Yes. Please, we would like to get your feedback. And what we just need you to do is to please QR scan what we are projecting, and we take you straight to the questions. There are not many at all. Just very few, questions to tell us how you feel about today. So please bring out your phone. Thank you so much, everyone. And I'm also going to do as well, because I've learned so much from each and every one of you today. It's just been so great. So please, let's QR scan.
Sorry, can I ask Aurora? Sorry, a lady. Oh, yes, great. And there's also the link in the chat if you don't.
And also the link in the chat. There is also the link in the chat. So please, let's take the next 1 minute or 2 minutes, thereabouts, to, I'm doing exactly what you are doing, answering the questions, because your feedback, it's very important to us in terms of guiding us on how we organize future events like this and other ones that you have suggested. So as you do that, thank you for those that have already completed the questions. I would like to use this opportunity on behalf of the organizers of this event, Western Sydney University, NETFA, which is a national education tool for female genital awareness, housed by Multicultural Centre for Women's Health in Victoria, and Female Genital Mutilation Awareness Australia, FGMAA. We would like to say a very big thank you to you. I'm sure every other organizer, every one of the organizers will point to the fact that we have all learned from you. You can see why we said this space at the beginning is a learning space. So we have all learned together, we have all shared together. So we would like to say, please keep up the great work you are doing in your state, in your local government area, in your community, and together we can eliminate the practice in a generation. So once again, it's 2:30 now. A very big thank you to you. And that's it for me. I don't know whether Rani wants to say one more thing before we go.
Can I just check? I'm having trouble filling out the survey. Is everyone able to fill it out, or because mine is coming up in a funny format? Is everyone doing okay? Oh, you could fill your in. Okay, great. Before everyone goes, would it be okay if we take a group photo for people who are okay with that? And thank you, Olaide, for summarizing so beautifully today's session. Irina, if it's okay.
So are we all able to get to the questions? Then we can stop sharing.
Yes, I think people
have already done. Thank you so much.
I'm still having problem getting the questions, please.
Okay. Patience, Aurora will help you with that. Aurora, do you mind just messaging Patience?
Okay.
And Irina, can you stop sharing the screen? And then for people who are comfortable too, let's take a silly group photo. And I'm just going to remove our pin. Okay. And yes, if you're comfortable too, please turn on your videos and we can take a quick group photo. It's wonderful to see all your faces. I'll just give people a minute to do that. Okay, and 3, 2, 1, big smiles, everyone. Thank you so much for being here. And just give me 1 more second while I do the second screen. Okay, 3, 2, 1. Thank you so much. Thank you, everyone. Olaide and Adis, was there any final words you wanted to say, or are we all
Thank you
good?
so much. Fabulous, everyone. What I want to say is to thank you all. Thank you.
Thank you, everyone, for attending.
Thank you. See you. Bye.
Thank you very much.
Thank you,
See you. Have a
everyone.
wonderful rest of the day.
Have a wonderful
Thank
day.
you.
Thanks, everyone. Thanks,
Thank
Rani.
you so much.
That was really
Thank
good.
you. Thank
Thanks,
you.
Kathy.
Thank you, patient. Thank you, everyone.
Keep up the
Thank
great job.
Thank you,
Thank
Kathy.
you.
You too.
Thank you.
No worries. I'll keep in touch, Rani.
No worries. Lovely to see you.
Okay?
Sorry.
Yes, I am. I am.
You can stay on, patients, and we can help you with that if you like. Yeah.
Oh, sorry. So hurt.
Whew.
Wow. Thank you so much, everyone.
Thank you. Hang on, I'll just
Thank
stop
you,
recording.
Kathy.
Thank